before I give the mic to Christian, I do imagine a day that a pharmacist will not dispense the medication, any medication, until they see the testing.
So, well, they have residency in pharmacogenomics, 2 per year.
Well, if all of us, Jim, all of us going to be precision medicine specialists, all of us are going to be precision medicine specialists, whether we like it or not.
So there are 2 master's degree programs starting out of the University of Chicago that are starting in the fall that are focused on precision medicine implementation. So I'm participating in one of those, and I don't know that there's a perfect answer. I don't know that there's perfect training in precision medicine because everyone seems to be doing it differently. But as far as the pharmacy, so Optum Pharmacy actually tried to do a backwards implementation of pharmacogenomics where they would trigger a drug when they got it and request the patient to do pharmacogenomics because United Healthcare was also their insurer. And it wound up not working out well at all because if you are, say, Dr. Liu or Dr. Jazier, and the 19-year-old Kroger pharmacy tech calls up and says, I think you're given the wrong drug, you might hang up. You might not. Okay. So I think there's, again, it's implementation that's really key.
It's going to take time. Yeah.
No,
we'll take the last question for
the only thing that I would like to add here is a fantastic point of view, but I think we are missing one part that is so we have the data, we tested the patients, but how we get the access to the drug to these patients. So one of the problems that I see here is that we don't have referrals for clinical trials. We have centers with clinical trials, but we have several factors that are impeding the referrals. We have the RVUs pressure from the clinicians that we need to give money for the hospitals. We have also the things that the patients are not accessing.
So I have the pleasure to
So there are several factors that are not
and
making
that is specifically the naive patients, CSF, to see the differences, because obviously
a flow that is making the patients access, also discussing all the disparities that we have in the access of testing and drugs. But we have several things here that are good, but we are not able to access to the patient or to give to the patient sometimes.
Yeah, I'll just say one comment. But in Saudi, we did experiment with making sure that every patient get testing free, the whole kingdom. And then we got pharma company to sponsor the test. They send it centrally. Any patient with lung cancer get the test done free of charge. And actually, and even I heard a model in Brazil that there are 5 big companies put parts of money in one part to test, do next-gen sequencing. So covering this financial issue and other is bigger than any one entity. There should be collaboration throughout different sectors and entities and so on. Any last comment?
I'll just agree with what you were saying. So it's the other part of implementation wasn't just getting a result, but it's being able to act on it, right? And access to drugs is incredibly difficult. I think one of the few things that could be considered positive out of the COVID-19 pandemic is the ability to interact with patients virtually, right? I guess there are 2 things. And the second, with respect to clinical trials, is the ability to actually enroll and participate in clinical trials remotely, right? That growing partnership where it doesn't have to be centralized at the institution conducting the study. You could partner with a local provider to help do some of the testing, and even have a lot of our drugs, gratefully now, are oral, right? So shipping the drug, et cetera. So hopefully the doors are opening a little bit, but the clinical trials won't be the only solution. Right, off-label use of drugs, because we're so siloed in disease-specific indications, and now with precision oncology and additional testing, we're finding that there's benefit in a disease that you otherwise wouldn't have thought of. So, and then there are the whole combination problems in getting 2 pharma companies to work together. So we could talk about that later.
So I really, you can tell how wonderful the panel is, and the different backgrounds and different perspective, and the matter is. It's very complex, and just getting smoke thinking about this issue. But hopefully, what we'll do, we'll come up with at least a paper that put these thoughts together, and then publish it. So I would like to thank you very much for a terrific job. Thank you all for staying here. Please give us your feedback and evaluation. I'll give you 1 hour now free time, extra time. All yours. Thank you.